So there's some other techniques other than colonoscopy to try and find early colon cancer or colon polyps. One of them is actually just very simple. It's looking for microscopic blood in the stool. This has been around for a long time, but the real innovation is using an immunoassay, an assay specifically looking at human hemoglobin. This is called an FIT or FIT test, and it's done every year on a healthy patient to look at their stool for microscopic blood. It's an at-home exam. It's then sent in to a lab, and the lab analyzes it for microscopic blood. An FIT test is actually very sensitive for cancer in the 70 to 72% range, but it's not really very good for picking up polyps. So it's actually a test that can detect cancer, but it's not really a test that could prevent colon cancer by finding the polyp before it has the opportunity to turn cancerous. So FIT is a very good option. It needs to be done every year, but patients have to recognize that this is a cancer detection test, not a cancer prevention test. On the same line as FIT is this multi-targeted stool DNA test. This is a very interesting test where the stool is analyzed for DNA and FIT, the fecal immunohistochemical test, so that it's actually a combination test looking for microscopic blood and abnormal DNA that's found in polyps that are turning cancerous or cancer. This test, like the FIT, is much better at detecting cancer and has a much higher cancer detection rate, but it's not as good a test for detecting polyps or preventing cancer. So again, it's a reasonable alternative for some patients, and they can consider that and talk to the doctor, but it's not a substitute for finding the polyps and preventing the cancer. So there's a test called Cologuard, which is actually a multi-targeted stool DNA and FIT test, meaning we're looking for abnormal DNA in the stool that would come from a cancer and microscopic blood. And the combination of the two together actually can detect 92% of cancers in the colon. So it's actually a good test to detect cancer. The problem is, like the FIT or microscopic blood test, it's not very good at picking up polyps. Not terrible, picks up about 40% of larger polyps, but it's not a test you would use to find polyps to prevent cancer. It's really a test you would use to find the cancer when it's already present. Concept being, if you find an early colon cancer, it's still highly curable. So that's the way we screen when someone has cancer. But with colon cancer, unlike others, the polyp is the precancerous growth. And by finding the polyp before it turns cancerous and removing it, you can actually prevent colorectal cancer. So virtual colonoscopy is actually a very good procedure for looking through an X-ray exam, really a three-dimensional reconstruction of a CAT scan for polyps that line the inside surface. The reason virtual colonoscopy hasn't really taken off is, one, it's not usually covered by insurance. Two, it requires the same prep as a colonoscopy. So most people taking the prep want to have sort of a one-stop shopping of a colonoscopy. And three is that if something is found on the virtual colonoscopy, they then have to have a regular colonoscopy to remove the polyp. That being said, it's actually a pretty good test for detecting cancer and larger polyps. So it is an option, and it is used by some, but until we get further coverage, I don't think it's going to be picked up widespread.